Welcome back. Chronic pain is unfortunately very common, and many of us struggle to find relief. We try everything from physical therapy to medications. Nothing seems to help.
There is a popular treatment that you may not know about, and some are finding real comfort with this plan. So here to share more about these treatments is Dr. Neal Pollack and nurse practitioner Marjorie Salem of Milwaukee Pain Clinic. Thanks for being here, you guys.
Good morning.
Thanks for having us. Good morning.
We've seen your mug a lot, but you brought a pretty new friend.
Yes, yes, because you've helped me promote, and we've grown significantly.
Yeah.
Marjorie has joined us. Marjorie is a very talented, knowledgeable, and intuitive healer who is a nurse practitioner, and she's well schooled in the specialized pain treatments that we administer.
Yeah, it's a big deal.
What do you think about these pain treatments, and what's your role with the practice?
Sure. So basically, I see a patient, whether it's an established patient or a new patient, and I figure out what exactly is going on with them, and I just go from there. If they're hurting, whether it's lower back or they've been in a car accident, I just really figure out where their pain is. And I'm the one who will select, do they need perineural, do they need OMT, do they need decompression therapy, and just, help them go
We
from
do a
there.
lot of things, and you've probably heard, well, most people have heard about regenerative treatment. And the one they hear about mostly is stem cells.
Yes.
Well, I'm here to say that in our experience, you don't have to go that route.
Because it can be expensive, right?
It's extremely expensive and
painful sometimes too?
It can be, yes, because there's more steps, but the studies have showed that prolotherapy is as effective as the stem cells, and it's safer, it's more efficient, and you mentioned it, it's cost effective. So why do you want to spend more?
Yeah. Well, kind of break down prolotherapy quickly. Like what is it, why does it work, and what can you treat?
It's in the regenerative category, and it mostly treats joint troubles, tendon problems, different ligament problems. But there's a whole constellation of other pain problems. And that's where these other specialized techniques come in. The one that we have a lot of experience with is perineural therapy. What does that mean? It's around the nerve treatment.
Is it an injection, or how does perineural work?
It's just under the skin, and it works by decompressing specific areas that have sensory nerve irritations. And there's a number of them. And I think you have a listing of some of these things.
We did. We showed some of them, and I remember even talking to you after my shoulder surgery. I was having nerve issues from a lot of inflammation and swelling and different things like that. But I think even when they look at this and they see even whiplash, I mean, so many people have that after a quick car accident or something like that, and all of these can be treated. Pain after surgery, that nerve entrapment, persistent sports injury, fibromyalgia, migraines. These are all things that can be treated with perineural.
Exactly. And a lot of physicians have not been schooled in these specific techniques. And that's why we're here, and that's why Marjorie is here.
How would somebody know if they're watching right now, and most people probably find themselves in one of those pain categories because it's such a common thing for people to have pain and chronic pain. How do you know if you're a good candidate for this type of therapy?
Most people are, number one. Number two, you know right away after this perineural therapy if you are a responder. If you're a responder, then with subsequent treatments, boom, 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 the pain is ratcheted down. The key is getting an evaluation. Traditionally, a lot of treatments entail medications, anti-inflammatories, cortisone. Oh, this didn't work, you need surgery. Well, we've saved a lot of people from going that route. Yes, we can use those treatments, but we also know how to combine. We know the neurology, we know the the pain and the complexity of pain itself.
What's it like, Marjorie, for patients, especially if they've had chronic pain, to have this therapy and suddenly they know what it's like to have a day, a life that's without pain?
It's really rewarding. I can literally do an injection on a patient, and within 5 to 15 minutes, or instantly, they feel completely better.
Wow.
And if not completely better, significantly better.
That's incredible.
I think so too. And I think here's what needs to happen is people need to give you guys a call, come on in, because what you can do is assess them, find out what is probably the best form of treatment for them. As you said, there's several different types. So contact Dr. Neal Pollack and Marjorie at Dr. Neal Pollack at MilwaukeePainClinic.com, or give a call to schedule an appointment at 414-453-7780 for more. Thanks so much for being here, you guys.
Thank you so
nice
much
to meet
for
you as
having
well.
us.
Yeah, it was
You're
really
welcome.
nice
Welcome to
meeting
Milwaukee.
you. Thank you.
Thank you.
Thanks, doctor.